how important, where on the scale, how much should we worry about our children being vulnerable to measles?
Measles is a highly infectious disease, and unfortunately, when the complications are serious, it can lead to things like ear infections, chest infections, diarrhea, dehydration, even inflammation and infection of the brain and the lining of the brain, which can in turn lead to, long-term disabilities and even death. So it is something that needs to be taken seriously.
Okay, well, I'm going to say to you, I had it when I was young. I can remember having it. And a lot of people, I mean, has it done me any harm, do you think? I mean, I don't know. Would there be any legacy to that?
I think you have to remember that for most people, a lot of these infections are going to just result in, maybe a rash, maybe cold-like symptoms, flu-like symptoms, a bit of a fever. You're quite right. For many people, it will be fine. But there are going to be a number of people that suffer the serious consequences. And it's for those people that we really need to try and protect ourselves.
We've learned a lot about vaccines, haven't we, through the pandemic and the concept of the threshold for herd immunity. Now, I understand with 1 in 10 children not taking up their MMR, vaccine rates are down to 85%. Where do we need to be in order for sort of community protection?
So ideally, we need to be above 90-95% in order to achieve a good population immunity. We know that even small insults in that level can result in outbreaks on a population level. And I think with COVID restrictions coming down, travel becoming more popular again, we have to remember that there may be travel from more endemic areas where measles is more endemic, and that will mean outbreaks will start happening unless those levels of MMR vaccine uptake increase.
Sarah, the main problem now is one of perception. Vaccine is a bad word to so many people. And a lot of people are going to say, what, not another vaccine to worry about? I know this has been around a long time, this MMR. What can you do to allay parents' fears on this one?
I think it's so important to remind parents that this is a safe vaccination, and it's something that we have tested again and again, and we know it's safe. We also know it's the best protection we have against measles, mumps and rubella, all of which can cause serious complications in the long term. So please do take up the MMR vaccine when you are invited. If you're not sure if you've had that vaccination done yet, you can have a look at your childhood red book, or you can contact your GP surgery.
Yeah, really good advice. I actually covered an outbreak in South Wales, 2012, 2013. It was a really big problem in the area. For some reason, uptake of the vaccines there went down and lots of children were taken into hospital. And I suppose what stands out from that, as opposed to COVID, is, of course, this affects children. And it is a stark reminder that, of course, when we see sick children, that's a very alarming thing to see. And there were deaths at that time. If we are to see outbreaks in this country, what's the medical response? Because in Wales, we saw vaccines being brought into schools, and there was kind of a rush of resources to the area to try and bring up that herd immunity level. What sort of thing could we see if we have outbreaks?
So we know that outbreaks are more likely to occur in places like nurseries and schools, which is why the first vaccination is usually done at 12 months and the second is done at 3 years and 4 months. And so it is in those areas that we really need to be protecting our children. And I think that is where the focus will go to if and when there would be an outbreak.